over 40,000 women will die of breast cancer every year. 5% of those deaths occur in women under 40. 20% occur in women under 50. So those are, when you're talking about women of that age, that's really impacts you. You're young, you got kids, that's a big deal. Good news is, over the last 20 years, survival for breast cancer has gone up tremendously. What we always have done for screening for breast cancer, start recommending self-breast exams once a month right at the end of your period. And when you do a breast exam, women are told to look for lumps. A lot of women, breasts are lumpy, so you don't know what you're feeling, and most women don't really want to feel anything, so they go, okay, I'm good, I'm fine. But when I tell patients, what you really want to do is get familiar with the normal appearance and normal consistency of your breast. You're not looking for lumps, you're not looking for anything, you just want to know how your breasts feel and look. If you do that once a month, right at the end of your period, you're going to get very comfortable with the normal consistency and appearance of your breast. And then if you notice any change, no matter what the change is, it could be a change in the appearance of the skin, it could be a thickening, it could be a lump, then you come in and get it checked. The next step in screening has always been an annual exam and having your doctor or nurse midwife or nurse practitioner do your breast exam also. And then at the right age, historically we started mammograms to get a baseline age 35, do it again at age 38, and then every year after 40. So what I do, I keep doing what I always did. I do the breast exam every year. I like the patients come in every year. I'll do self-breast exams starting at 25, get the yearly mammogram at age 40, and I just keep doing it. The Pap smear looks for precancerous or cancerous changes on the cervix. It's probably the single best test, screening test that's ever been developed. It's cheap, easy, I know it's not comfortable, but effective test for cervical cancer. Where you come in and I would look at the cervix under magnification, look for the abnormal areas and biopsy. So now I have tissue, so that the pathologist who evaluates it says it's normal, it's mild, moderate, severe. New recommendations. And I start Pap smear as soon as young girls become sexually active. Because cervical cancer is a sexually transmitted disease associated with the HPV virus, human papilloma virus. Very, very ubiquitous, very common virus. 90% of sexually active adults have been exposed to this. Carrying it around, don't even know they have it. You could get it 20 years ago, it could start causing problems 20 years later. So most people have it. But what happens, I've been in practice now for 25, 26 years. I see some of the same patients that whole time. You come in every year, you talk to people, you get to know them, they get comfortable. It's not just a Pap smear I'm doing, it's not just a breast exam I'm doing. There's a whole lot of stuff that we talk about and I look at. There's a lot of things that we do. People develop a trust or relationship. So, if you see somebody year after year after year, that trust develops and people come in and talk about problems at home or at work or depression. Where if I'm only seeing them every 5 years, they're not going to have that comfort level. There's different problems arising in each age group there that if you don't see them often enough, it's not going to be addressed. So you see, if you don't have a doctor you can talk to, then you ought to change. And you should be able to bring up anything. Cancer, ovarian cancer, the symptoms from it could be bloating, loss of appetite, just not feeling well, maybe a little pelvic discomfort. Very, very common symptoms. You can have diarrhea. What may be a tip-off though, about ovarian cancer if it lasts. Usually those symptoms, if it's from a virus or something, gone in a week or 2 weeks max. With ovarian cancer, it just persists. So if you get symptoms like that don't go away in 3, 4, 5 weeks, then that should be checked. The problem with ovarian cancer, as most of you probably know, is it's there for a long time before it causes those symptoms. And then you're stage 3 or stage 4 before it's getting diagnosed. That's the problem with ovarian cancer. If you pick it up early, it's great. Again, the BRCA1 and 2, if you have strong family history of that, and you test positive for that, it's recommended you have your ovaries taken out once you're done having your children. Again, the recommendations, typically recommendations, colonoscopy beginning at age 50. Colon cancer gets more frequent as we get older. Again, it's a late presenter. I mean, it could be there for a while before it's going to cause you symptoms. Typically, you get precancerous polyps and stuff develop. Get it I recommend you get it at age 50 to 55. And then how often you do it after that? is up to what they find at the initial test. If they don't find anything, then it's 10 years. If they find precancerous polyps, then it may be 2 or 3 years. If your family history is stronger, it may be more frequent than every 10 years. The next topic is osteoporosis, which is a very common condition. That's thinning of the bones, weakening of the bones. High percentage of women have this, okay, and it's a silent disease. My mother, when she died, was under 5 foot tall. She had been 5'7". My dad couldn't hug her without breaking a bone. And literally ruined the last, I meant to put a picture up, I'm sorry. It ruined the last 15, 20 years of her life. She died at 88. She was healthy otherwise, but it ruined her life. And the mission of mine is to try to prevent anybody else from going through this. So at your younger ages, make sure you exercise, weight-bearing exercise, take your calcium and vitamin D. Bone density test says 65. I prefer to do it at 50. When you go through menopause, I want a baseline. I want to know where you are at that point. Some women already have advanced osteopenia, which is a stage before, or they have osteoporosis. I want to know that. I don't want to wait till 65, then they lost so much bone density, or they may have had their fractures already, and I can't do anything about that. So I like to get one right after menopause for a baseline. Depending on what that is, it determines how soon I'll do it again. Exercise is hugely important for everything. I mean, exercise, if people exercise, all these instances of all these things, diseases go down.